Hey, good morning. Welcome to Open Mics with Dr. Stites. It's Wednesday, November the 23rd, the day before Thanksgiving. I'm Dr. Steve Stites, Chief Medical Officer at the University of Kansas Health System. We're thankful you're with us today. 30 million Americans of all ages suffer some kind of hearing loss. Put me in that category. For many, a hearing aid is the answer. But that has historically required a prescription from a doctor and a fitting from an audiologist, just like eyeglasses. Until now. Congress passed a law requiring the FDA to create a whole new kind of hearing aid that people can buy at the drugstore without a prescription, which could save thousands of dollars. But is it a good idea? Are you going to get the right fit? Will it really help your hearing? Where can you go wrong? Our guests today are going to help us sort through the changes that have transformed the hearing aid market. Joining us remotely is Dr. Jim Lynn, an ear, nose, and throat surgeon here at the University of Kansas Health System. And with us in the Dolph Simons Jr. Family Broadcast Studio is Dr. Christina Fletcher, an audiologist and ENT here at the health system. Thanks to you both for joining us this morning. I am so excited about having this program. I know I'm going to learn, especially because, I have a lot of hearing loss and problems too, so this is perfect. Questions from our viewers are an important part of this program. We want to hear from you. Get yours sent in to us now on YouTube, Facebook, Twitter, and the Medical News Network. You'll find those links right here on your screen. Alexis Del Cid will join us a little later with those questions. Dr. Lynn, these first over-the-counter models are expected to look a lot like the devices you can get through a hearing professional. But there are some important differences. Talk to us about what those differences are.
Well, when you get a hearing aid through a hearing professional, you typically get the exam in person and then the audiogram performed in a soundproof booth with standardized and calibrated equipment. And then when you purchase a hearing aid from a hearing professional, typically it comes in a bundled package where you get service for anywhere between, say, 1 to 4 years included in that package. When you buy one over the counter, it's more of a self-serve type of device where you typically download your own app online and you don't get the exam. You usually get some sort of app-based hearing test where they try to fit it or automatically fit it for you that way. Some of the hearing aids that you get over the counter these days come with bells and whistles and some don't, and so some are pretty standard and bare. But what it does is take the middleman out of it, and that's the reason why, for a large part of it, they cost much less.
Dr. Fletcher is an audiologist. You give hearing tests to patients. Earlier this week, we sent Alexis Del Cid to show how simple it is to get a hearing test here at the health system.
I'm here with audiologist Dr. Katie Plum, and Dr. Plum is going to show me how easy it is to get my hearing tested here at the health system. Where are you taking me?
You're going right into the hearing booth.
Soundproof?
Soundproof.
How often should someone get their hearing tested?
A good standard is every 2 to 3 years if you have normal hearing. Ears are nice and clear. Beautiful. You are going to push the button when you hear some tones, but I will put these earphones in, go over there and talk you through it.
About how long does the hearing test take?
They take about 10-15 minutes. All right, we're going to start with tones. When you hear a sound, push the button, even if it's very, very soft. Now I'm going to say some words that get softer. Repeat them back to me as best you can. I'll start in your left ear. Airplane.
Airplane.
Popcorn.
Popcorn.
Hot dog.
Hot dog.
Okay, the next words are going to be louder and recorded. You'll hear a man say the word, repeat the last word.
Low. Owl.
I'm going to put a piece behind your right ear. We'll continue to push the button to the tones.
What does this one do?
This is bone conduction, so it's stimulating your inner ear directly, going behind the eardrum straight to the cochlea.
So I'll be interested to see if you notice anything, because a lot of my friends in the news, they have slight hearing loss in the ear where they wear their earpiece.
I would say you have a high frequency hearing loss in both ears, a mild loss in the left and a moderate loss in the highs. Most likely for you, it makes a lot of sense. It probably was your earpiece.
Thanks, Dr. Plum.
Yeah, you're very welcome.
Dr. Lynn, how does someone know when they need a test?
Well, typically it begins when you're having problems communicating in background noise. That's the first thing that I have found to really go. And a lot of times it's people's friends or relatives that complain to them that they can't hear. And so not uncommonly, I'll see a patient who's brought in by their significant other or their children saying, my mom or dad can't hear. And so that's usually the typical sign that you're missing important things. And somebody else may have to bring that up to you.
So it's not just a joke then that when my wife says, do you ever hear what I'm saying to you? That maybe it could actually be a medical problem. It's not just, maybe I'm ignoring her.
That's true, but that's a very common complaint as well. And I tell patients I can't fix selective hearing, so.
Selective hearing loss is more of a problem, huh?
Yeah.
So, Dr. Lynn, what is that hearing loss? How do you differentiate, like, what's normal aging? Like, okay, I got a little older. And what is something that's more accelerated? How can we distinguish that?
There are some age-related norms that are out there and fairly well established. However, how rapidly you lose your hearing depends on your genetic makeup. And also, getting a history is important to determine if the speed of hearing loss and the degree of hearing loss is due to other causes such as extensive noise exposure or chronic ear disease, or even sometimes some autoimmune diseases or subtle infections can cause hearing loss.
Yeah, that makes sense. So, Dr. Fletcher, if people forgo a hearing test and opt to get an over-the-counter device, what should they expect?
So we actually don't recommend foregoing a hearing test. We recommend anybody that has any kind of hearing loss or difficulties hearing to make sure that they get that hearing test by an audiologist, so that way you know exactly what's going on with your hearing. We can direct you in the right direction as far as seeing Dr. Lynn if it's a surgical case, or going the over-the-counter route if you have that mild to moderate hearing loss, or going more prescriptive hearing aids if that's what your lifestyle entails.
So is it your sense this is getting the right hearing aid? Talk to how crucial is that? Because like I've been wearing glasses since I was in the 4th grade, and I'm kind of not very visually good without them on. And if I don't go get them tested every now and then, I'll get headaches and I mean, it's hard, right? Mm-hmm. And so you got to stay in tune with that. If you don't get your hearing tested, how do you know you're going to get the right hearing aid fit?
That's kind of the difficulties with what we're seeing with over-the-counter. They're meant for those specific patients that have mild to moderate, that have a little bit of problems. They're not having issues all day long. They just need a little bit of volume. So it's very specific to a particular patient. That's why getting your hearing test to know exactly how severe or how your hearing loss looks is important.
So does a hearing aid restore your hearing back to normal?
It doesn't.
I know. I don't want to go get one of those. It's hard enough to hear the symphony now as you get older, because you lose a little bit of that higher frequency, lower. I mean, you just don't respond to sounds quite as fast.
So it does help a lot of different areas in your hearing as far as keeping that nerve active. Giving us sound will keep that nerve firing and hopefully give you better understanding as you go on.
How long does it take to get used to a hearing aid?
Usually a couple weeks. We do have a trial period on hearing aids, so if you ever purchase a hearing aid, a prescriptive hearing aid, you will have that trial period to try it out and see if it works for you, which I think is important. So a couple weeks.
So, Dr. Lynn, how do I know if it's more serious? Like, I really need to go get a doctor to see me. I know, like, I have ringing in the ears. I know some people have loss of balance. When is the time you got to say, man, I got to take this a little more seriously than just going to the local CVS and picking up a hearing aid?
Well, that brings up an important point as to whether or not we should forego that examination. I personally feel it's better serving the House of Medicine to improve the availability of hearing aids out there, because the problem is so enormous with hearing loss, and now there's the relationship with early onset dementia associated with it. But for individuals who have, say, chronic ear problems, one side hears worse than the other, ear pain, drainage, heaven forbid, bad headaches, facial weakness, imbalance. Those things all point to the need for further evaluation for potential underlying reversible or treatable pathologies that may cause the hearing loss or be at the root of the hearing loss.
Well, you said two things I want to go back to. You said, heaven forbid, related to a headache and hearing loss. Why is that?
Well, because sometimes with certain patients with asymmetric hearing loss, it's a result of a benign tumor along the hearing and balance nerves called the vestibular schwannoma. They're not that common. However, that's one thing we don't want to miss. Additionally, somebody loses their hearing in 1 year suddenly. I can't tell you the amount of times I've seen emergency room patients referred to me several months after the fact that lost their hearing suddenly and are given antihistamines or nasal sprays because they say, oh, you have eustachian tube dysfunction, when the truth is they lost their hearing suddenly of the nerve variety. About 2 to 4% of those cases are due to vestibular schwannoma or a brain tumor.
Something you want to go evaluate, because surgically you can help address that, I take it.
Yes, surgically or just knowing about it, I think is a better option for these patients.
Okay, now you also said something about dementia. Let's go back to that. You said if hearing loss can be associated with the onset of early dementia, help us tie that together.
There have been several studies in the past and ongoing studies relating to hearing loss and memory loss and dementia. We found that these large studies have determined that relationship to be real. And so we're not exactly certain why that may happen. You can imagine an elderly patient with hearing loss who's become more withdrawn socially and just chooses to avoid conversation. That in itself can predispose somebody to not think as clearly down the road and long term. Also, there's a theory out there regarding people's or individuals' hearing loss that may mean that they are struggling to try to understand or follow conversations, and taking away that mental faculty from other parts of the brain may actually also contribute to hearing loss and dementia. Dementia.
Okay. So I do notice, and I think you hear this from patients, especially as they get older, that they don't quite have the same ability to hear the symphony and hear the fine notes. Is that a normal part of aging?
That the majority of age-related hearing loss is typically at the high frequencies, and with that, you tend to lose some of the fine, spectral envelope effects of hearing and processing. So things do sound differently as you lose your hearing with aging.
So, Dr. Fletcher, get a hearing aid. Are people normally fairly happy with those, or do they just like, oh, this is what I wanted to have?
So it depends on their expectations and their willingness to wear them. So if you're willing to wear them, go out and give them a good try, and they're fit properly. That's the biggest thing, is they're fit properly. Then you tend to do really well with them. A lot of patients love them and wear them every day and go about their day, and they can hear a lot better.
Okay, I'm just going to say that sometimes I've seen people with hearing aids now that are so interesting because you can barely tell that they're there. Mm-hmm. They're so, I mean, my dad used to have hearing loss. Those big things that kind of looped around his ear, went into the ear, all that. And now they're so much smaller. Talk to me about first of all, that's pretty cool, but what's the next phase of development going to look like in hearing aids?
Hard to say. I tell patients all the time, I'm like, we've gotten to this point of technology with hearing aids that they have come so long from even the 6 years that I've been in the field. Smaller is not necessarily always better because people want connectivity to their iPhones. They want rechargeable batteries and all these things that make their life easier with them. So you have to have a hearing device that's maybe a little bit bigger. So
do the ones that are fit onto your eyeglasses work?
Those aren't around anymore.
Oh, they did? They died? Oh, man. What happened? I guess it didn't work. All right. So how long do they last once you buy them?
Typically 5 to 7 years, but if you take good care of them, you can get a good longer time.
All right. Now here's the real question. What's the range of cost for hearing aids?
So like Dr. Lynn said, there are places that do that bundled effect, so they have their audiology services wrapped into it. So I would say anywhere from $2,000 to $6,000, depending on what you get.
That's a big range. And is there an advantage to spending $6,000?
Yep, it's based off of your lifestyle and what your listening needs are. So our young workers that are constantly in difficult listening in situations, those more expensive devices are going to live with you. So that's
what you want. Okay, so I want to protect my hearing, and I'm at Arrowhead Stadium. What should I do?
You should wear your hearing protection. Roll down earplugs are okay. We also do custom devices, so custom earplugs that are specific to your ear shape. So those could be good as well.
But my little earpods, do those sound?
No.
Oh man, that is not the right answer. All right, it's time for us to check in with Dr. Dana Hawkins, and we're coming back to our head in a minute. Medical Director of Infection Prevention Control. He's joining us for being on the road. We've got several numbers to look at today. Wait a minute, Hawkins. Okay, before we go to let's start with the COVID numbers. Where are you today? Where are you?
I'm back up with my mother and father just to celebrate the holidays.
Which is a great place to be. Now, I'm going to do something because I saw you a few moments ago, and you're not expecting this. You have to stand up.
No.
Yeah, come on, brother. You got to stand up for a minute. Just for a second. I wore a tighty-whitey on this show. You got to stand up, brother. Come on.
First, look at that. Okay.
Oh, there we go. Rock, chalk, J, hockey, you. All right. Well, that was good.
People will be keeping up to date with them this weekend. Good luck to them down in Battle for Atlantis, I think.
All right. Well, let's go ahead now that we've had the pajama look. Let's do the COVID numbers. How are we doing?
You know, I do think we actually may be long lost brothers, Steve, because I started wearing glasses in 4th grade as well.
Oh my God, we may be.
You know, the red hair, the glasses, the sci-fi stuff.
I had red hair when I was younger, a lot younger, as it turns out, or reddish brown.
Today our numbers have been, again, Steve, like we said, they're just not where we want them to be for active infections. But 22 active infections, 2 in the ICU, 0 on the ventilator, still 19 in that recovery period. Again, I think cases have been trending up on a weekly basis nationally. We know cases, hospitalizations will trail cases by 2, 3, 4 weeks. So we're just kind of keeping our fingers crossed, really continuing to promote being up to date with the booster, as well as getting tested early and getting on Paxlovid.
Those are obviously all the right things. And just to say, Dr. Fauci had what was probably his final news conference yesterday, because he's retiring as of January 1. And he said, this is probably my final news conference. So first of all, hats off to the man, because he has been brilliant throughout this crisis. Yeah. And he's had withering criticism for reasons that are like just not, quite frankly, if you really understand the medical science behind this, are just completely unfounded. And has done, I think, a great job at just trying to tell us the truth as we knew it at any point in time. Remember, you and I have always said, we build the airplane while we fly it. And that guy, he was flying it. And so that'll be a loss. But he said we look forward to maybe hopefully not as bad of a winter as last year.
Yeah, and I think that's true. Hopefully not. We knew that with Delta, it was a huge surge in cases and hospitalizations. As we got further out from Delta into that Omicron surge, less of a peak of surge of cases, but also less of a peak of those hospitalizations as well. And I would just like to point out, MMWR from CDC has released a couple early articles specifically on this point. People who did take Paxlovid, whether vaccinated or unvaccinated, had a 50% less chance of going to the hospital. So we know that works. Get tested early, get on Paxlovid. Also, early data from the bivalent boosters show there was an increase in the reduction of symptomatic COVID as well, which we know that the vaccines don't protect against infection. They can have a minimal effect. And certainly early data from the bivalent boosters does show that can happen as well. So,
yeah, I was interested to see that as well. And again, that was just coming out yesterday. But it was good information to see that the bivalent may look better. Now, it was against more BA5 and a mixture of some other stuff, not as much as BA 1.1 or BA 1.111, whatever. And still some concerns about XXF. But I think, nevertheless, that's all antibody stuff. The hospitalization and severe illness continues to show protection from the boosters, and the bivalent being better than the former vaccines.
Yeah, absolutely. And I think there was a recent Science or Nature article. I think it was looking at data from macaques, I believe, but the data actually showed that there was an increase in the breadth, an increase in the differences in antibodies created when getting those bivalent vaccines for further protection as well. But, for everything that we know, all the data continues to support the fact that those T cells continue to work. There are very little changes on those areas of the spike that the T cells recognize, and that is really what gives us a lot of protection against severe disease and hospitalization.
Yeah, I mean, I think we get caught up in this question of antibodies and all that, and disease, and not getting the disease.
Absolutely.
That's not the point of a vaccination. It was the point very, very early on when we thought we could help control it. But as more variants came along and people didn't follow the infection control guidelines, what ended up happening was we have the vaccine. The emphasis on vaccination is now much different. It's not so much about not acquiring the infection, but minimizing the effect of the infection. So that's what we should be focusing on. I think people still get too caught up in whether or not there's disease transmission. No, not the point. It's how we can modulate how sick you get. All right, well, let's look at some of the flu and RSV data as well, Hawkeye. Let's first of all take a look at flu. Not the best graph.
Yeah, so, this is showing, and again, this is just the purple bars are any positive tests in the Kansas City division of University of Kansas Health System with the PCR or antigen test. Remember, we have two different tests. But unfortunately, just like you said, the purple bars, the total number is going up as well as the percentage. So we are just continuing to see an increase overall in the influenza circulation and positive testing in our community at our health system.
Yeah, bummer of a graph, though, because we are seeing quite a bit of it. What about RSV? Is it still rising or is it kind of plateaued?
I think just this one trend here, again, the percent positive has gone down. That's the black line. The total overall number of cases has kind of really stayed about the same. It seems to be on a downtrend. That is good news as well. And again, the orange or yellow colored is the adults who are testing positive, either with the PCR or antigen, and the blue is the number of pediatrics. And again, this is the Kansas City division. This is both in the hospital and in those ambulatory clinics. But this still signals that there is wide circulation of RSV going on right now as well. And I would say that from our admissions, we have about stable admissions for RSV in the hospital, around 10 or 11 as we did last week, and the same thing for influenza for admissions as well, about 18, just under 20. Again, the majority of those are adults, but of course we are more of an adult hospital. We have many more adult beds compared to pediatric beds, so we have to put those numbers into context as well.
Yeah, good points all around. And so your thoughts on Dr. Fauci, because I know as an infectious disease doctor, you've long admired him.
Yeah. Oh, absolutely. I mean, from the early stages, with HIV and that epidemic that you lived through, he's just been a voice of reason, of calmness, of really looking and dealing with the science. Unfortunately, as we know, the pandemic has really been politicized, and there was, I think, and I believe, undue reaction to him and animosity, but it was really continuing with the science, really just a consummate civil servant, and really just wanting to have the best health, promoting the best science for all Americans, but also for people around the world, with the HIV initiatives, obviously with helping to get Operation Warp Speed going, to get those vaccines that we now have that we can deliver to other parts of the world as well. So just a consummate servant, and I think a hero to many, despite all of the unneeded or unbacked animosity and criticism towards him.
Yeah, he didn't deserve the criticism he got, but he sure has had a great life of public service and has done a great job helping guide us through multiple different epidemics here in the U.S., including several influenza, bird flu, avian flu. SARS-CoV-1, SARS-CoV-2. The guy has been had a remarkable career. All right, Alexis Del Cid, any reporter questions? If not, let's jump to our other ones, our community questions.
We are getting so many great community questions. This is a topic that clearly is striking a chord in a lot of our viewers. The first one comes from Kim Moore-Bosley, who would like to know, is there a correlation between hearing loss and dementia?
Well, we just heard that, I think, from Dr. Lynn earlier. There is a correlation. One we don't completely understand, Dr. Lynn, is it withdrawal from society, or is there also a physiologic issue?
Yes, there is a correlation between hearing loss and dementia. I think that is fairly well established. I personally feel that with some degrees of hearing loss, even ones that don't bother the individual, I think it's important to look into the degree of hearing loss and provide an attempted amplification or use of hearing aids of any sort to help that out. I think the release of the over-the-counter hearing aids will allow easier access to that amplification and help mitigate those effects of dementia.
Sam has a great question. Sam wants to know, he has hearing loss in both ears, so he would like to know if he has to wear 2 hearing aids or can he get away with just 1?
Dr. Fletcher.
I think.
I'm sorry.
Well, Fletcher, go ahead.
Go ahead.
Yes, wearing hearing aids in both of your ears is important. Our brain uses what's going on in both ears to locate where sound's coming from and a lot of different auditory processing things. So wearing 2 hearing aids is definitely important if you have hearing loss in both.
Sarah wants to, has some more questions about the price. Earlier we mentioned some prices that made some people's eyes pop. First of all, can you reiterate how much hearing aids cost? And then Sarah would like to know why they cost so much and how much does insurance typically cover, if you could talk a little bit about that.
So they range in price from $2,000 to $6,000, depending on your services and follow-up visits and all that kind of stuff. Like our clinic does a bundled service. They cost so much because you get the expertise of the audiologist fitting the device. They are like little computers in your ears. Insurance doesn't typically cover them. I think a big part of that is Medicare doesn't cover them. So maybe once Medicare gets on board and helps out a little bit, then maybe the rest of the commercials will.
When you describe it like...
Hang on, how much does it cost to just, do you think, go in a drugstore and pick some hearing aids up now?
So there's a difference. There's the over-the-counter, which are ranging from around $300 for one to $1,000 for one. And then there are another separate device that's just an amplifier. And those are your under $100.
Okay. And so just to put it in perspective, if you think about it, your new iPhones cost $800 or $1,000. And they do a lot of cool stuff. But imagine the hearing aid is a fraction of the size of an iPhone, but yet incredibly sophisticated. So
for sure.
Yeah, I think you're probably paying a little bit, I'm going to guess, Dr. Lynn, for just the technology and the size.
Right.
Yeah, there's a deeper portion, or there's a different layer to that question that was asked. Number one, 30 to 40% of the cost of the hearing aids you get in the bundled plan is the cost of the labor and work and tune-ups that are required for the following 1 to 4 years. Additionally, there's the research and development component of the hearing aids, but there's also, unfortunately, a logistical component to it where until October of this year, hearing aids were highly regulated. That created a little bottleneck regarding how you could get them. And to complicate matters, only about 84% of the prescription type hearing aids are created by 4 to 5 only manufacturers. So there's a pseudo-monopoly effect also taking place there. And finally, as Christina had mentioned, Medicare typically does not cover them. And that allows the prices to go up without Medicare or insurers typically who can negotiate and contract on behalf of the patient and themselves. Those prices are going to get driven up. The White House had created this over-the-counter hearing aid policy to help open up the bottleneck, essentially, and drive the cost down with competition. And you can bet in Washington, D.C. that those 4 to 5 hearing aid manufacturers fought tooth and nail. Additionally, I've taken a peek at some legislation out there. The White House would also like to, like CMS or Medicare, to cover patients with moderately severe to profound hearing loss, which actually puts you in a cochlear implant range. That hasn't passed last I checked.
Alexis.
When it comes to the over-the-counter shopping for a device, Travis wants to know, are there specific features that he should look for or ask for? Do you have a lot of options when they're over-the-counter?
So it's kind of a hard question because they're rolling them out more and more now that it just came into effect. There are going to be ones that have more technology inside them, and there's going to be ones that don't have a whole lot of technology inside them. They're very basic. They're going to be, you can change the bass, the treble, the volume. So I think that it's hard to say. We're going to have to see what happens with reviews and things like that.
Ruth Allen would like some clarification on how you would define background noise or a situation with background noise.
So a situation with background noise would be you go to a restaurant and there's the clanking of the dishes, there's the server talking, there's another table around. That's a situation with background noise. Or just simply at your house, somebody's doing the dishes and you're trying to watch TV and you're trying to have a conversation. Any kind of noise that's going around you when you're trying to converse, that's considered situations where there's background noise.
And would you typically say, this is another question that Ruth had on conjunction with that, is if there's someone around you who keeps talking louder, is that a sign that they're experiencing hearing loss?
The people are talking louder to you.
You know how
No,
somebody,
like
it's like somebody's like, God, that person talks really loud
Exactly.
in any conversation. Can they just not hear themselves talk?
So voice is not always correlated with hearing loss. Some people are just loud talkers, but
Okay.
it's worth a shot of getting your hearing checked.
Hey guys, when you just real quick, when you saw the video with Alexis in the studio,
Yes.
they also wanted to look at their bony conduction. Talk to us about the importance of how much the ear's working and that bone part behind your ear. What's that about?
So bone conduction tests the inner ear, the cochlea. It tells us how your nerve is hearing. So we want to make sure that when we push sound through the outside of your ear and through the bone, that it correlates, that it's the same. Where if it's not the same and there's these big gaps, that means we need to see Dr. Lynn or one of our surgeons.
That was a really interesting part of the test. I didn't know, I'm not a doctor, clearly. I didn't know I could hear through the bone in my ear. Like I could hear what they were saying when there was nothing in my ear. That was pretty weird. As a person who didn't know a lot about how that works, brings me to Janet Coy's question. She wants to know, are hearing tests typically covered by insurance? The test, not the hearing aid.
Hearing tests, yes, are typically covered by insurance.
Okay.
Yearly.
A yearly hearing test. Okay. Beverly Van Horn has a great question about ringing in her ears. She says she has ringing in her ears that began about 9 months ago. She wants to know if that will ever go away. Boy, that's a frustrating thing when that happens.
Yeah, I get it all the time. Dr. Lynn, is it ever going to go away? I've had mine for like 20 years.
Well, as I tell my patients, ringing the ears doesn't really come from the ears. It comes from the brain. Most of the time in response to some degree of hearing loss where the brain is deprived of that sensation of sound to stimulate it. And similar to a phantom limb phenomenon, the brain makes its own sound. Unfortunately, once your brain perceives it, I wouldn't say hears it, it's in the ear of the beholder. You're always going to find it if you try to find it. So it doesn't go away, but what happens is it becomes less noticeable to you over time, typically. But if you stop and think about it, you're going to find it.
Is that the same when you have an injury to your ear? I know when my dad was a teenager, someone fired a gun right near him. They were out hunting, and he's had ringing in his ear ever since. But is that in his brain? I always assumed it was because his ear was damaged.
Well, what happens when you have an acoustic trauma like that, a firecracker goes off in somebody's hand or next to somebody, or a loud noise occurs, you get a temporary and sometimes permanent change in your hearing. But when you get the temporary change in your hearing, your brain, again, loses that input and generates the sound to fill that void, at least briefly. And if it's a permanent hearing loss, then it tends to stay.
Jean has a really good question, especially with how everybody's always wearing earbuds nowadays. How do you wear earbuds or earphones when you have a hearing aid?
So a lot of hearing aids are Bluetooth compatible to your phone. So you can stream your phone calls to your ears or your music to your ears. That's usually pretty standard now.
I have one last community question that just came in, and this one is for Dr. Hawkinson. Or Dr. Stites. It's from Angela Yinks-Saylor, who would like to know, is the new Pfizer COVID injection not as effective?
I mean, not as effective as their prior ones. So I think the question is, and we'll cover both Pfizer and Moderna in this question, Hawkeye. I think earlier today we were pointing out with the new evidence that suggests actually the bivalent may be more effective, not less.
Okay.
Yeah, I think more effective in what we were talking about with against symptomatic infection, which we know the other one, certainly that effect wears down over time. It wanes, probably because of the antibody levels, just like Dr. Stites said. But we are really looking at those rates of hospitalization and severe disease. And for all accounts and purposes, we do expect them to continue to have high rates of protecting you from hospitalization and severe disease. We are waiting for that data and analysis right now.
And I think, do you think there's a difference between the COVID, between both Pfizer and Moderna anymore? I mean, so far we've seen minimal differences. Sometimes you can see there is a slightly statistical but not clinical difference between the two. Yeah. I'm going to bet it's going to land on the same spot.
I have one more question.
I agree with you, and I think that's why they say they are interchangeable. I agree with you. And again, remember, so many people have been infected and reinfected. That also contributes to increasing your immunity as well. So, but I think for all accounts and purposes, just like you said, Dr. Stites, they are equivalent.
Alexis, you had another question.
One more question. My girlfriends and I are always talking about how we're worried our kids are going to have hearing loss earlier in life or more hearing loss because they're always wearing earbuds, and we're always telling our sons to turn down their earbuds. Are you seeing younger and younger patients that have hearing loss?
Dr. Lynn, what do you think?
Yes. I think if you look at nationally over the past 2 decades, with the earbuds in place, I think that is contributing to increased rates of hearing loss at a younger age. My typical rule of thumb has been try not to turn it up beyond 60% to 70%. Although they do make some earbuds for kids that limit the output.
So here's a question for you guys. You know, the new iWatch has this decibel meter on it and tells you when you're in trouble for hearing. Are those things reliable? And talk to us about this thing about decibels and hearing loss and how to know when it's too loud, because, you know, I'm not sure people really have that filter. So I'm not certain how accurate the decibel meter is in an iPhone watch or an iWatch. The national standard from OSHA states that hearing protection must be worn and time of exposure must be documented above 80 decibels. According to OSHA, you cannot spend more than 8 hours working in an environment consecutively for 8 hours above at 90 decibels, and every time the decibel level goes up by 5, that number is reduced. That time is reduced in half. So at 95 decibels, you can't be there for more than 4 hours. So there's the decibel level and the time of exposure that both play an important role in permanent trauma to your ears. So Arrowhead Stadium could be dangerous. Yeah,
it could be dangerous.
I still go, guys. I've got to confess something, but I already have to see you. So. You know, I'm telling you, when Mahomes goes to Kelsey, you just got to share.
Exactly.
All right, well, this has been a wonderful conversation today, and I want to thank both of our guests for being here. We're going to have these guys back, Alexis, because people are going to want to know more and more about this, and it's such a really, really big deal. Yeah. Let's get some final thoughts. Dr. Lynn, we're going to start with you.
So, hearing loss in this country and nationally is becoming more of a global problem. I think increased awareness has really been sparked by the notion that dementia and hearing loss have an association. And finally, I do think serving the House of Medicine that the over-the-counter hearing aids has unleashed a greater access to amplification for individuals, just like the reader glasses have helped people such as myself who have problems reading small, fine print. I think we're heading in the right direction, and hopefully insurers will also take a closer look, including Medicare, at providing coverage for hearing aids. But as we all know, CMS has a limited bucket to pay out of.
Yeah, and then maybe it'll spark some innovation as well when you have these so many more people coming into the marketplace.
For sure.
Dr. Fletcher, final thoughts.
I think that the takeaway from here is that if you're having difficulties hearing, get your hearing tested, regardless if you're going to go over the counter or hearing aids. Audiologists can lead you in the right path as far as what's going on with your ears.
Yeah, that sounds very like a very smart thing to do. Let's get it figured out, and it means I have to go get my follow-up appointment. Dr. Hawkinson.
Yeah, thank you to our guests. We know all of your senses are so important. Touch, smell, taste, vision, hearing, obviously. Dr. Lynn and his colleagues have helped me out so much with removal of wax from my ears. Maybe that's your problem, Steve. Maybe you need that.
Yeah.
And I'm overall worried about wearing my AirPods and also those little things that go into your ear for the IFB for the show, too. So hopefully I won't get too much more hearing loss. But would like to just comment again, we've had some good questions about the vaccines, and we talked about them. The vaccines right now continue to look like they are providing that protection, even a little bit more against symptomatic disease, even if it's for a short period of time. But I think that's very important because we are getting into the holiday season now, where people will be traveling and maybe going to other people's houses who are maybe more at risk of disease. But also importantly, Paxlovid has shown to help reduce that risk of hospitalization for those that are vaccinated, unvaccinated, and especially those at high risk. So get tested early and get on treatment, but most importantly, keep up with your vaccinations.
Excellent advice, and I just want to say a word of thanks to our guests today.
And
go ahead, Hawk.
Sorry, I thought we had one more thing too. I would like to say that congratulations to Rockhurst, who recently won the state 4A, the Class 4A or 4 in Missouri soccer championship. They did repeat, and my son was on the team and was able to get a medal. So congratulations to Rockhurst there for that repeat state soccer championship.
And congratulations to the proud papa. So I do want to say a special thing, because it is Thanksgiving. Thanks to our guests and to all our outstanding guests, but also thanks to our amazing studio crew. You don't get to see these great folks behind the screen every day. They do remarkable work. To all the people who help prepare the scripts, get the show up and going. Thanksgiving, thank you. Before we say goodbye, I want to share something pretty special with you all. You may have heard about the Phillies. Now, I'm not talking about the baseball team, though I did want them to have won the World Series, and not those terrible Astros. But anyway, not the baseball team or the cheesesteak sandwiches. These are the awards given out to the Kansas City area not-for-profits doing amazing things around the metro. Nonprofit Connect, the group behind the award, started out in the 1970s as the Council of Philanthropy. Phillies. Get it? And we are so proud because we recently won 3 Philly Awards. One was for our statewide chief medical officer news coverage on the spread of COVID across Kansas. That was one. The other 2 were for the show called Sunny Says, featuring Jessica Level's adorable daughter, Sunny. Sunny, you are so awesome. Yeah, your mom's pretty good too, but anytime you want to be on the program, Sunny, come right on. One of those shows was the show How to Be Safe on Halloween. The other on why it's safe to be vaccinated. I also remember she did a great one about masking. We're going to share that video with you again in just a moment as a reminder that it's not too late to get vaccinated against COVID. Remember to get your flu shots while you're here, or while you're there as well, getting that COVID shot, because you ought to do what Sunny says. Alexis, back to you.
Dr. Stites, are you going to sleep with that award under your pillow?
No, ma'am. I'm going to leave it down here because the truth is, this studio deserves it.
It's beautiful.
I just got a big mouth.
Congratulations to you on the Philly Awards. Congratulations to Dr. Hawkinson's son and Dr. Hawkinson for raising a pretty cool kid who won the state soccer championship. And we want to thank all of you for joining us today. We love our viewers. We're going to be off tomorrow and Friday enjoying Thanksgiving with our families. We hope you have a wonderful holiday. We'll be back with you next Monday morning at 8 a.m. Jess will be back. She's enjoying some much needed time off with another morning medical update. We'll see you on Monday morning. Have a happy Thanksgiving. And here again is an encore to Sunny Says It's Safe to Vaccinate.
Hi friends, it's Sunny, and Sunny says it's safe to vaccinate. But don't take it from me, I'm just a kid. Take it from these super smart docs.
Hey Sunny, what's up?
Like Dr. Angela Myers at Children's Mercy Hospital. She really knows her stuff.
Sunny, there are so many doctors and scientists that have been working so hard to make sure this vaccine is safe and effective. We have already vaccinated over 1 million kids.
I was brave, I got my shot. Sunny says it doesn't really hurt, just a quick pinch, and then you're on your way. By the way, it's okay if you and your parents have lots of questions, but Sunny says make sure you go to the right places for answers, and make sure you're asking the right people, like your pediatrician. My parents talked to mine. Hi, Dr. Lauer.
Hi, Sunny. I told your parents that the risks from COVID were much scarier than any risk from the vaccine. You'll be safer after you get it. Hey, Sunny, are your friends following your lead?
You bet they are, like my friend Tommy Ralph.
Hey, Sonny, I got my shot. Look at my guns.
Tommy Ralph and Antonio did it for their grandparents. They died after battling COVID. They really miss them and want to make them proud.
Be strong like me and get the shot.
And be strong and brave like Isabella.
Hey, Sonny, check out my vaccination card. Oh, yeah, baby.
And her brother.
I did it, and so can you.
Remember, Sunny says your parents want the best for you.
Tell all your friends to listen to mom and dad and their doctors, not just anyone on the internet.
Your parents might want you to wait to get your shot, but Sunny says keep wearing your mask so you can stay safe and healthy. Let's get vaccinated so we can all get back to normal. Well, the new normal, but we're cool with that. Remember, Sunny says it's safe to vaccinate.
Coming up Monday on the Morning Medical Update. It was a 1-2-3 punch for Alice Marshall. I'm Jessica Lovell. Coming up on the next Morning Medical Update. How treatment for her rare face cancer led to a devastating colon diagnosis, and then it hit her lungs. Now she's thanking her medical team who's kept her in the clear.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.